Good morning, everybody. My name is Deborah Byrne from Deborah Byrne Psychology Services, known as DBpsychology across social media. This morning, I'm going to do a very quick video on this week's blog, which is all about chronic illness and your mental health. So my focus is on your mental health, not on the actual chronic illness. Chronic illness can encompass many different illnesses and disabilities: heart, cancer, diabetes, fibromyalgia, MS, and a whole range of other things. I mean, the list is endless. Basically, it is an illness that would last more than 3 months and is probably life, for life. Now, the first thing I want to say to you is, when you get the diagnosis, you are probably going to go through a huge range of emotions. It could be relief because you are waiting to get that diagnosis for so long. It could be years waiting for a diagnosis in some cases. It could be stress. It could be anger. It could be fear. It could be sadness. It could be you're going to go through a whole range of illness, so a whole range of emotions. You'll probably also go through a grieving phase, because you've got to let go of any future expectations maybe that you could have had, and you're going to need help with that. You're going to need to allow yourself to grieve, and you're going to need to readjust your thinking. So, of course, any illness is going to affect your mental health. Now, saying that, always think about it as being, I'm going to be proactive. You can take the stance of, okay, I'm going to go to bed and I'm going to pull the covers over my head and I'm not going to do anything about it. If it has got to that stage, then you definitely need to be seeing somebody like me. It's not unusual to go through a phase like that. It's not unusual to go into a depression. And you do need help. You really and truly do need help to get out of that. I would go see your GP, and then I would come and see somebody like me, and talk it through, and talk through what your options really are for you in the future, because your future doesn't have to be all doom and gloom. Okay, it really is up to you and how you handle this, how you mentally prepare yourself, how you take control of the situation. In our household, we have all our children are disabled, and there are mild disabilities. There are also hidden disabilities, and they've had them since they were born. I have another child. One of them also has a heart condition. She was born with a heart condition. So we have been there. We know that there are obstacles. We know that there are, it is tough at times, not just on the person themselves, but on the family. And the one to say to you is, I have been doing this for over 30 years, and as a parent, I've been doing it for over 30 years. It is hard. I've been there. But it is survivable. Absolutely, 100% survivable. It doesn't mean that if you have an illness, a disability, or anything else, your life is over. In fact, you can get very, very proactive in dealing with your life. And I have found that my own children have, it hasn't held them back. It really hasn't. They've gotten on with their lives. They've gone to university, and they have, they're now going on as adults and living their lives, and have done all sorts of activities. So I think it does really come down to your mental attitude and how you want to take it. So to me, if it was me again, starting off at the beginning, I would say being proactive. It was the one thing, piece of advice I got very early on. Find out as much information as I could about the various conditions and information is power. It empowers you. If you know what you're talking about, then when you're faced with a bunch of doctors or a bunch of other specialists, you know what they're talking about. And I have listed out ways in which you can do that. And one of them is to join up with, it'd be very rare these days if there isn't a national organisation to do with your illness or disability. So get in touch with them, look at their website, get that information. There's usually some sort of a liaison to talk to somebody. There are people there, and there are, in some cases, support groups around the country, and I would join them. I really would. I would get involved, talk to other. If you're a parent of a child that's disabled, if you're a parent of a child with chronic illness, I would join the organisation. I would get involved on a local level, and see what's there. The same if you're an adult and you have a chronic illness and you have a disability, get involved in the national organisation. Get that information off the net. Get involved, get talking to people that are the same as you, and that gives you empowerment. It also helps to build your self-confidence. When you are talking to somebody else that can understand where you're coming from, that isn't a specialist, that isn't some doctor with all this highfalutin, words that maybe you don't understand initially. If you can talk to somebody who really knows where you're coming from and can explain it to you in layman's terms, as they say, that gives you power. That gives you the information you need. And that is what you need at the beginning. From there, I would say to you, look at it in terms of, if you are dealing with a lot of doctors, if you are dealing with a lot of different specialists, look at it as you're in charge, you're the head of the team, and they work for you. Okay, they work for you. This is your body. You are going to be in charge, and you get to decide, okay, who you need to see, when you need to see them, and be more, put yourself out there, get it in there and say, right, you guys are working for me. Let's plan this out together. Don't let them just say, okay, we're going to do this, this, and this. Go, no, I want you to explain that. Why do we need to do this, this, and this? They're working for you. It's your body. Okay, you've got to feel empowered enough to say, I'm taking back my body, I'm taking back the control, and I am the head of the team. I am the head of the team, not the specialist. He or she is not the head of the team. I am. It's my body. I would also say to you initially, maybe you're going to start thinking, we need to make a lot of decisions. We need to, move house. Big decisions. Think about a big decision that you'll think, in a panic, you might think, I have to make these big decisions. No, you don't. In most cases, you don't. There are very few cases where you would actually have to make a massive life-changing decision immediately. And I'm talking about a terminal illness in that case. And even then, I would ask your doctor, how long do I actually have? And, I would take a break. I would, if you can get a break away, if you can, slow down a bit in that case and say, okay, I'll make that decision in a few weeks. I'm not going to make it immediately. Don't let anybody else rush you into making any major life-changing decisions, is what I'm trying to say. No matter what the diagnosis is. And I go into more detail. I go into a lot of detail. This week's blog is actually quite long, so you might need a pen and paper. You might want to print it off. You might want to, just take your time and read it, and maybe take one point and digest it, and then go back and get another point. Now, the usual suspects, of course, when we want to help ourselves and our mental health, is going to be our diet. We can always take charge of our diet. We can always take charge of any type of exercise that we can do. You can check in with your physiotherapist or an occupational therapist and see what you can actually do. Again, you're going to them. You're saying, okay, what can I do? What can I do to change this? Ask to be put in touch with a nutritionist. What can you do to help me? You're getting them to work for you. You're getting them to give you the information, and you're going to be proactive, and you're going to do, take charge of this illness or this disability, basically. There are a couple of things you can do. You can always take up a meditation. Any form of meditation that's going to relax you, is going to reduce your stress levels, is going to help you sleep better at night. And I won't recommend, I wouldn't recommend meditation if I didn't know for a fact it works. It does work, particularly with reducing stress and helping you to sleep. The other thing is you can do is, if you were stuck and you were feeling, I can't get out of this sad feeling. I can't get motivated. I just can't do this for myself. You need to get help. Being proactive means asking for help and reaching out. If you need to come and see somebody like me, you need to go and see a counsellor, do it. Just do it. Just say to yourself, I'm going to do this for me. I'm going to talk this through with somebody I need to do it. It's so easy when you have a lot of problems to feel completely overwhelmed. So the one thing I would say to you there is get a journal and do a brain dump, what we call a brain dump, and write it all out. Write down everything that you can think of where you're having issues, whether it be with your finances, whether it be with, to do with your actual illness itself, whatever it is, write it all down. And then only pick one problem. One problem. Try and pick a very small problem that you can get a quick win out of. Okay, what you want to do is, when you're feeling that overwhelmed, is pick a small problem, something that can be tackled very quickly and very easily, or you can ask somebody to help you tackle it very quickly and very easily. And why I say that is, that will boost your confidence. You'll get a quick win and it will boost your confidence. And that will help you then, give you the momentum and the motivation to go on and tackle more of the problems. Now, of course, when we tackle a problem, we want to, any problem or set a goal, anything at all, we want to be very specific. Okay, so pick your problem, set a deadline, then go and look for anybody that can help you do it, and then get in and do it. But the other thing you need to do is plan ahead, because sometimes with some situations you need to think, what pitfalls could there be in this problem that I need, or this goal that I'm setting myself? Would I need to think about? Maybe I need to tackle. So in the blog, I actually talk about going out for a walk. And I'm only giving that as an example. You might want to take up, say, a form of exercise if you're able. So whatever the form of exercise that is, it could be getting out in the fresh air for 10 minutes. And what you say to yourself is, okay, I'm going to do 10 minutes of walking today, and every second day I'm going to do it. So I'm going to mark in my calendar, Monday, Wednesday, Friday, I'm going to be going for my walk. You're going to mark down the time. So at 11 o'clock, I'm going to go for my walk. And then you're going to think, okay, what happens if it rains that day? What happens if I'm not able to get out? So you're going to say, okay, well, maybe I need some wet gear. Or it's going to get colder in the winter and I mightn't want to go out walking then. What else can I do? Is there some other form of exercise? Or, can I join a gym? Can I take up swimming? Can I do something else for 10 minutes on Monday, Wednesdays and Fridays at 11 o'clock? That will give me my exercise, but it has tackled the problem of the cold and wet weather. So plan ahead is what I'm saying to you. Always plan ahead. See what the pitfalls are and see how you can overcome them. In all this, I would say to you, keep a journal. Now, if you keep a journal, it's going to help you, one, do a brain dump, as I said. You can brain dump at any time into a journal. Two, a journal is great for tracking your moods. You can keep a record of how you're feeling that day. Three, it's great for keeping a track too of your gratitude. Always at the end of the day, think of at least one thing, but I would recommend 3 things that you are grateful for that day. There always is. There is always something to be grateful for. No matter how bad your day was, always do that. That will be pushing what I call a deposit into your positivity bank account. Okay? And when you have a good supply in your positive bank account, that carries you forward on your bad days. So putting things like that into that journal, what you're grateful for, how good your day went, and even how bad your day went. So then the other thing thing in that journal will be to talk about how you felt that day. And you're getting out the emotions. You're getting all this out of your body. And you're giving your mind permission to rest. So therefore, it has a knock-on effect of helping you sleep better. The other thing I would say to you is let go of any obligations that you have. Let go of any negative people. So I'm not talking about if you really get real enjoyment out of anything that you're doing, so volunteer work or something else. If you're getting real positivity out of that and feels, it's giving yourself confidence and things like that, keep that going. But if you need to, cut back. Or if something isn't and has been for a long time, you've been going, oh, this is such a drag, I can't do this anymore. It's my guilt that's keeping me in there. Then let that go. Okay, now let it go. Let it go completely. It's not going to do positivity, so let it go. And the same with negative people. Now's the time to be building a really good team of positive supporters, and make sure you have your phone on a list and to hand, so that you can call them at whatever time and you need just a chat, that you have that team there. I talk about it in my self-care class, and I should have I will have a journal coming out which will go through a whole list of that whole list of putting together a positivity toolkit. I have a new one of those that I have ready to go, and I'll be putting that out in the next couple of weeks, so keep an eye out for that. And the other thing I would talk about, the one thing I think that causes most problems once you move away from any physical or mental issues is it causes the most stress, is finances, of course. I'm not a financial expert, so do remember that when you talk to national organisations, they are very good at telling you what your rights and entitlements are. Okay, a lot of people don't realise that they're entitled, if you're living in Ireland, that you're entitled to a medical card with certain illnesses and disabilities. So please check that out. I would also talk to MABs if you have, particularly if you have a mortgage and you've been diagnosed with a chronic illness or a disability. Talk to them. They will actually take the pressure off you, and they will talk to your creditors. You don't have to deal with the bank. MABs will deal with the bank. You'll only have to deal with MABs. It'll stop all that paperwork coming to your house. It will stop all that harassing phone calls and things like that. So do look into that. Do go and talk to them immediately if you need to. Go, and they should even be able to tell you over the phone if you're entitled to something. Citizens Advice, the Citizens Information, brilliant people for telling you what you're entitled to in terms of money, and helping you get the forms and getting them filled out. And again, I can't stress this enough, the national organisations for your disability or your illness will also be able to help you with these things. They know what other people have gotten. They know what you're entitled to under the law. They will tell you. Okay? So, message from this morning, reach out. Please just reach out. There is always somebody there that will help you. I know it's tough. I've been there. But, positivity at the end of the road is you can have a really good life, and it can be really positive. So I'll say good morning, and I'll see you all again next Wednesday. And thank you for listening.